6 years. That's roughly how long it's been since COVID-19 changed the world. 6 years since lockdowns. 6 years since overflowing intensive care units, despite what people might say. 6 years since daily press conferences. Sometimes telling the truth, sometimes mispresenting the truth, sometimes not really sharing facts at all. 6 years since face masks, social distancing, vaccine conversations, and arguments that in many ways haven't really ended that much. Certainly depending on who you ask. COVID was either a triumph of modern science in regards to vaccinations, or it was one of the greatest failures of modern governments around the world. Anthony Fauci is either one of the most respected public health physicians in American history, or one of the most controversial. The vaccines were either miraculous inventions, or they were dangerous and life-threatening. Lockdowns either saved millions or caused irreparable harm. And maybe perhaps enough time has now passed that we can step back. Certainly not to reopen own wounds. I've covered COVID on this show a number of times in various ways. But certainly to ask, what have we actually learned? Have we learned anything at all? So today, I'm going to take a look specifically at the UK COVID inquiry that is still ongoing, what each module has found, where governments clearly failed us, and where institutions succeeded. And we'll finish by examining the current ongoing US Senate hearing involving said Dr. Anthony Fauci, what's actually happening, and why accuracy matters now more than ever. So, what is the UK COVID inquiry? Well, unlike a criminal court, the inquiry isn't deciding guilt or innocence, and it isn't trying to imprison politicians, whether you feel they should be imprisoned or not. Its purpose is actually much broader. It's basically asking what happened. Why did it happen? Could it have been avoided? And most importantly, in my opinion, as an IPCN, how do we do better next time? Because I think that distinction matters. People often assume that if an inquiry criticizes the government, it's accusing people of criminal wrongdoings. In this case, it's very, very nebulous conversation. But that isn't necessarily true. Equally, it shouldn't be there to excuse mistakes either. Its job should be to establish facts. Facts. So, starting off, naturally, with Module 1, which is being looked at by the Baroness, and it's looking at resilience and preparedness. And this, in many ways, set the tone for the inquiry. Now, the positives. The UK already had pandemic plans. They weren't as robust as they led us to believe they did, but they had pandemic plans because I sat in on tabletop exercises. There was experienced public health agencies around the UK, leading scientists, world-leading scientists from the UK, internationally respected epidemiologists, I should say, depending on how you browse it, NHS staff with enormous expertise across the board. But the inquiry has also found that the UK had largely planned for influenza, which exactly is what it had planned for, the tabletop exercises I sat in on for influenza. COVID was not influenza. Different transmissions, different incubation periods, different patient pathways, and thereby different pressures. Now, the inquiry has concluded for that module that the pandemic planning had become too narrow. It was only focused on influenza. I can testify to this, having sat in on various bits and pieces. It was too narrow, it was too rigid, it was far too optimistic, and there'd also been repeated warnings over many years that health and social care lacked spare capacity for this type of pandemic event, whatever it might have been the cause. And those warnings weren't adequately acted upon. That is just a fact. And the reflection here is that certainly one lesson isn't that Britain had no plan. It had a plan, just the plan was very different from having the actual right plan. That is an important distinction, but it's also very important to bear in mind that the plan was not the right plan. So, political decision-making is Module 2, and this has probably received the most media attention, at least so far. Again, positives. The government had to make decisions unlike anything this country had seen since World War II. That is absolutely true. And the information changed daily. Don't I know? As an IPCN, we would give advice one day and then it would change the next. It was very frustrating. Scientific advice evolved rapidly, hence the change in information, and many decisions genuinely had no obvious right answer. That leads into the negatives, though. Because many decisions genuinely had no obvious right answer, it was frustrating that nobody would admit there was no obvious right answer. And rightly, the inquiry has criticised poor coordination, unclear leadership, delayed decision-making, and fragmented communication. Difficult relationships between Westminster and the devolved administrations certainly didn't help matters. There was also rightfully criticisms of informal communication, including the use of WhatsApp messages for official business and inconsistent record keeping. The inquiry doesn't suggest that every decision was wrong, and not every decision was wrong, but there was lots of decisions that were wrong. And the inquiry suggests that many decisions were made in an environment that was less organised than we should expect and we reasonably deserve during a national emergency. Now, the third module looks at the NHS. Now, as a nurse, and with loads of nursing colleagues and people that I know as nurses, this part probably resonates with me the most. The inquiry rightly praised healthcare staff repeatedly, the doctors, the nurses, the healthcare assistants, the cleaners, the porters, the people that were there on the shop floor in the thick of it, day in, day out, the laboratory scientists, the people working in pathology and biochemistry, etc., the paramedics, everyone who worked in the NHS, the administration staff. People adapted extraordinarily quickly in circumstances that we had never experienced before. New wards appeared almost overnight. They did have patients in them, despite what the media leads you to believe. Operating theatres did become intensive care units. I know this myself. I saw it. Staff worked beyond exhaustion in many, many cases. But the inquiry also identified the long-standing weaknesses that COVID exposed rather than created out of a vacuum. There was workforce shortages. What a shocker. We already knew that. Lack of spare beds. We already knew that. Years of undercapacity. We kind of already knew that. Delayed care, burnout. That's just some of them. COVID didn't create all of these problems. Some of them existed already. It just revealed them and highlighted them. And many of them, members of staff in the NHS have been banging on for years and years and years. Now, Module 4 looks at vaccines and therapeutics. This is where nuance matters, very contentious, very controversial, very emotive. Some people expected the inquiry to condemn vaccines, and it didn't. Others expected it to describe them as flawless. Didn't do that either. I feel it maybe could have gone a little bit further in the problems with the vaccines, but that's neither here nor there. The inquiry praised rapid scientific collaboration, the MHRA, clinical trials, NHS delivery. Millions of vaccines were delivered safely. I know colleagues who delivered them. Chief executives, directors of nursing, people who were very senior were on the shop floor. I saw it myself. It described a programme very rightly as an extraordinary achievement, which it was. But the areas for improvement were communication, public engagement, 100%, transparency, 100%, monitoring, and future preparedness. One thing worth remembering is that vaccine monitoring didn't stop when vaccination began. It expanded, as it does in vaccination situations. And this is exactly what pharmacovigilance systems are designed to do. Now, it's important to note, and there'll be pushback on this, and there'll be comments, and there'll be criticism, and there'll be challenges that I don't know what I'm talking about, and other people who aren't scientists, or aren't nurses, or aren't infection control nurses, or aren't biomedical specialists will still challenge it regardless from their armchairs. There was vaccine injury. There was. With any vaccine, there was. The vaccine wasn't initially a complete failure. It actually worked. There's loads and a wealth of evidence to show that for the very initial strains, it doesn't matter where you believe the virus came from, how it got into the world. The fact is, it got into the world. The origins of it aren't as important as how we dealt with it, because it was an eye opener, as I've already illustrated, that we just weren't prepared to deal with it, despite all the reassurances that we were. Any pandemic, whether it be a novel coronavirus like this was, which was a new one, or influenza that's well known. The vaccine did work against the initial strains, but very, very quickly, because it was a novel virus, it mutated and adapted and made the vaccines ineffectual or less effective. That is what happens with viruses. This one being novel, mutated quicker than anyone could develop vaccines that would work against it. You didn't have the time frame that you do with, say, influenza. Personally, I'm still, I know it works. And I know it prevented illness, and I know it prevented death. I also know it will have caused injury. And I don't know anyone personally, but I know it did. And I know people did suffer profound side effects, and some people didn't suffer profound side effects. I still think it needs a lot more research. I don't think any vaccine should be mandatory, outside of maybe, again, I've mentioned this before, a few exceptions, and not mandatory. But if you're going to go to a malaria high country, you'd be a complete prat to say, my immune system's great and I've never been vaccinated in my life and I take vitamin C, so I won't get malaria. Yeah, mosquitoes don't give a crap, mate. You'll get malaria. You should be vaccinated against it. Things like that. If you work in healthcare, you can't refuse to get vaccinated against hepatitis B, because certainly if you're going to be working with patients and bloodborne fluids, it'd be ludicrous, even if you could refuse it, to go into that environment. That's silly. But outside of those few exceptions, I don't think vaccines should be mandated. I think it should always be choice, whether it's to vaccinate your kids or vaccinate yourself or support vaccines for other people. I strongly advocate for vaccines because I've seen what happens when people don't get vaccinated against meningitis, measles, chickenpox. That doesn't mean they have to. It should be a personal choice. But I've seen what happens to people who get these infections. Just because someone never catches an infection, has never been vaccinated, a lot of that is luck. You know, people say, well, I never got vaccinated against meningitis and I've never caught meningitis. I've never caught meningitis, and I wasn't vaccinated against meningitis. It didn't exist in 1975. I've been to university and college. I've just been to universities and colleges where there was never incidents or outbreaks of meningitis. Other parts of the country, when I was at university and college, there were outbreaks of meningitis. A lot of it is just luck and happenstance and geography and just fate, if you believe in that kind of thing. Medical fate. But just because you haven't been vaccinated against something and never caught it doesn't mean that for the rest of your life you will never acquire it. However, COVID vaccines are far more nuanced, and there is a lot of work that needs to be done into exploring them. The virus is still mutating all of the time, so vaccines are not as effective as they were. And also, it wasn't created in a vacuum. The COVID vaccine, people had been working on a vaccine for coronavirus for decades, because it is the common cold. This was the next step. Yes, there was billions and billions of pounds of funding that appeared from nowhere, thrown into it and stuff, but the vaccine wasn't created just from nothing. Coronavirus vaccines had been getting developed for decades. They just never effectively found one. And this isn't effective. It doesn't cure, it doesn't kill off COVID. It just, if you get it, it can lessen the symptoms, or you might not get it at all, depending on loads of factors. It's multifactorial, the severity of the strain, your immune system, when you were vaccinated, if you've had it before alongside the vaccination. If you've never been vaccinated and never had it before, the viral strain might not be strong enough for you to acquire it and develop symptoms. You might asymptomatically carry it. There's loads and loads of factors. The point I'm making is it is not 100% straightforward. Now, Module 5 looks at procurement. Not the most exciting of topics, but probably deserving of the harshest criticism. I think we can all agree, NHS associated or not. The inquiry examined PPE procurement, emergency contracts that sprung out of nowhere, the value for money for PPE, this so-called VIP lane that appeared to exist. And there were absolute examples where contracts lacked transparency, equipment proved unusable, some of it was absolute garbage. Huge sums of public money were wasted. And we can think of the investigation that's taken place into Baroness Moan and things. There's loads and loads of problems with it all. But the inquiry also recognised that governments worldwide were competing for scarce supplies. Speed genuinely mattered, and nobody, again, was prepared for the magnitude of this type of situation. The challenge in that emergencies often require rapid decisions, but rapid decisions can reduce safeguards. And that's where things start to fall apart. Now, Anthony Fauci. No discussion of COVID would be complete without mentioning Anthony Fauci, even in the UK. And he wasn't directly associated with us. But for decades, Dr. Fauci was one of America's most respected infectious disease physicians. He was. He advised 7 presidents. He helped shape responses to HIV and AIDS. He didn't originate AIDS, which is what people say that he did. He aided in the Ebola crisis, SARS, MERS, COVID-19. But during the pandemic, he also became one of the most polarizing, controversial public figures. Now, critics, rightly or wrongly, point to change in advice on masks, communication regarding Wuhan. That is a big one. Public messaging, school closures, vaccination policies. And we had a lot of the similar issues in the UK with our government. Supporters of Anthony Fauci argue that science evolves, which it does, which I've already mentioned. Recommendations change because evidence changed. That does happen, especially in infection control, especially in a pandemic type situation. Leaders were making decisions in real time with incomplete information. That might be someone's fault, that might not. Now, recently, Dr. Fauci appeared before a Republican-led Senate committee. I think it has just ceased a few days ago. And on legal advice, he invoked the Fifth Amendment against self-incriminating himself during questioning. This has generated a lot of headlines suggesting that not only is on trial, but it was a bit of a ludicrous thing to do. I think he invoked it over 100 times. It isn't accurate that he was on trial. The committee subsequently voted to hold him in contempt and have referred the matter to the Department of Justice. Whether prosecutors pursue the referral remains to be seen. Whether they can because of his pardon, who knows? Invoking the Fifth Amendment is a right in the United States. It isn't by itself evidence of guilt or innocence. Some supporters say the committee is performing legitimate oversight. Critics say the process has become highly polarized and politicized. You could argue both. At the time of this recording, no criminal court has found Dr. Fauci guilty of any offence. That is down to the court of public opinion. An important question is, did we get any of this right? Now, the scientific response was astonishing. Within a year, vaccines had been developed, tested, authorized, manufactured, distributed worldwide. Genomic sequencing, the science behind it all, transformed outbreak investigation from that point onwards. And international collaboration accelerated research at an unprecedented speed. Healthcare workers achieved extraordinary things under unimaginable pressure. The people on the shop floor, absolutely inspired and phenomenal, and it should never be forgotten. However, there were things we got wrong. Preparedness, communication, public trust, political transparency, transparency in general, care homes, the management of care homes, delayed non-COVID care, mental health support, the isolation that ties into the mental health support of the elderly, or not just the elderly, anyone who lived by themselves, education, schools being closed, social inequality. Many of these issues weren't created by COVID, but COVID exposed them and exacerbated them, and there just weren't procedures in place to deal with them. And that is wrong. One of the things I always try to do within plain sight is resist simple answers and polarize things. I try to find a balance between the facts and the fiction and find somewhere in between. COVID isn't a story of heroes versus villains, and nor is it a story where every criticism was justified and every official decision by contradiction was beyond reproach. That's not true at all. Governments made serious mistakes. Scientists made mistakes. Journalists amplified poor information. Commentators on social media spread claims that were later shown to be false. Still do, still will, following on from this, I have no doubt. And yet millions of healthcare professionals, researchers, public health specialists, laboratory scientists, support staff did extraordinary work in extraordinary circumstances. The UK COVID inquiry isn't finished yet. There'll be more and more to come. More modules remain, and there will be more lessons that emerge that we need to learn from. The Fauci hearings are part of an ongoing political legal process, and that's not concluded either. But if there's one lesson I hope we carry forward, it's this. We have to be willing to update our views when the evidence changes. Changing your mind is not weakness. That's how science works. That's how good journalism works. And ultimately, that's how, as a society, we learn. Because 6 years on, the goal shouldn't be to win the argument. It should be to ensure that when, not if, when the next pandemic comes, we're better prepared than we were the last time.